So how can we know, and I'm not asking about a specific program at the moment, how do you know if an approach to helping a child or a teen improve EF deficits is likely to be effective? And by that I mean, is it a subjective assessment by a teacher or a parent? Is it a child self-reporting? Or, and this is what started this question, is somebody asked you and I asked, what's the metric?
Well, there are objective measures of executive function, but normally the kid comes to you with a problem in life. The kid didn't come to you with a problem of, I took this executive function measure and I scored 60 on it. The kid comes because something isn't working right, or the parent brings the kid because something isn't working right. And what you want to see is that is showing some improvement, some real life outcomes. But if you look at studies, they'll look at these executive function measures. And it's very interesting, like CogMed is the computerized cognitive training approach that has the most evidence and the strongest evidence. But even for CogMed, the benefits are very narrow and fade away relatively quickly. And if you ask parents, if you give parents the brief, and you ask them, is CogMed helping with attention and with ADHD symptoms? Parents generally report yes. But if you ask an objective observer, if you give objective tests of attention, if you ask teachers who don't know whether the child's doing CogMed or not, there's no evidence that CogMed helps ADHD or attention. So is it that the parents are more sensitive to the changes that CogMed is creating? Or is it that the parents have expectations that CogMed is going to help and then are seeing things in line with their expectations? We can't be sure, but what we do know is that only the parents or teachers who know that the child is in CogMed have ever given any support to CogMed helping with ADHD symptoms or attention problems. All the objective measures don't find it so far.
Is that true for the SMART program also, which is kind of an online computer program over weeks to months?
I don't know any research on SMARTs. So okay. I know research on things like luminosity, brainware Safari. There are lots of these computerized packages. There's cognitive psychologists have done training with the NBAC test. There was a big proceedings in the National Academy paper some years ago saying that practicing the NBAC test would improve your fluid intelligence. It didn't hold up, but that got a lot of press at the time. People have worked with complex span training on all different cognitive tests. None of these are showing any generalized benefits beyond what the person trains in the specific training program.